and welcome to our third annual Autism Hope Summit. I am just so excited. I think I'm excited on every speaker, but I'm really excited about this one. Dr. JerryKartzinel, I have known him for so many years. He is one of the most awesome docs out there. So you guys are in for a real treat today. Today we're going to be talking about a topic that often I feel gets overlooked because often we're talking about kids that are younger. We're going to be talking about bigger kids and bigger problems. So welcome, Dr. Jerry. Thank you so much for being here today.
Well, thank you very much. It's exciting to be here and to present this topic, bigger kids, bigger problems, because you're right. Everybody is always focused on the cute little kids, 3, 4, 5, 6, 7 years of age. But you know, after they get puberty going and they're older and their voices drop, they're not quite so cute, and they can actually be a handful to deal with, both from the parents' point of view, the educator's point of view, the parents that are working with them, and of course their own lifestyle, the quality of life. So we're here to talk about some of the things that our parents can be educated on that I have found as I've grown with my practice, from my own son being a cute little guy to a 22-year-old man who needs to be shaved.
Oh, goodness. Okay, so before we jump into that, I want people to understand why you're so passionate about what you do and why you're even helping a community like ours.
Well, I am a board-certified pediatrician, so pediatrics has always been my passion. And I've always taken care of special needs kids. I've really been drawn to them. Shortly after my son was diagnosed with autism and my wife encouraging me to take on autism as a full-time profession, I got into this and learned way back that there were a lot of really interesting things we can do to improve their way of seeing things, improve their quality of life. You know, I get attacked sometimes by people saying, why do you treat autism as a disease? It's not a disease. This is something to be celebrated. And I agree, but if a child with autism breaks their arm, we'll set it. If a child with autism has a mole that needs to be removed, we'll remove it. So why would I get approached about taking care of children on the spectrum who are constipated, or chronic diarrhea, or inflammatory bowel disease, or migraine headaches, or allergies? That's what we do. And you know, when we take care of the underlying, as they call comorbid diagnoses, the children improve dramatically. I mean, you could think about it as if you had children who were not sleeping and children who were sleeping, and you were the teacher. Which group of children would you rather have in your classroom that day? The kids who slept the whole night, or the kids that were up all night tantruming? So we can improve how they learn, how they grow, how they feel about themselves, how they feel inside, and of course, how they interact with our world.
I think that, you know, I wish more doctors would jump on the bandwagon with 1 in 68 children. We need more of you out there, right? I know your waiting list is ridiculously long. And, you know, with the bigger kids, obviously my son just turned 16 this last week, so I'm right there with you. Now, I happen to think he's still cute, you know, although this shaving thing I'm a little bit nervous on, and we'll talk about that in a little bit. But aggression, you know, with our children sometimes is a really big problem, and it often doesn't hit until puberty. That's even in our case. So what do we do? You know, what are our first steps? It's sometimes really scary, and you can get lost in Google, right?
Oh, absolutely. So aggression, that's a big problem. And for me, it's so rewarding to fix that problem. Mm-hmm. So we have to look at what stage of intervention are the parents in with aggression. Some of us have been gluten-free, dairy-free, soy-free, corn-free for years and years and years. So it's not a dietary source. Some of our kids have had their bowels worked on and they're not constipated, not diarrhea, they're not having bowel issues. We've already looked at migraine headaches. We've already looked at MRIs. So in other words, depending on where we're entering, if I've got a family right now who's watching this and said gluten-free, dairy-free, what's he talking about? So we have to start with the diet. So I'm going to paint a picture now of a child who's aggressive. And for some of you, you're going to be saying, yeah, we did all that. We did all that. We did all that. Wait on, we'll get there. We'll get there. For others, you know, just because they're drinking sodas and eating pizza all day, that can be why the kids are grumpy. Because if you think about it, I have kids with such self-limited diets that they're eating all processed foods and lots of sugar. French fries, potato chips, pizza, that's usually it, and soda. Nutritionally, they're depleted. Where are the vitamins coming from? You know, if we don't take vitamin C in every day, we're going to get scurvy, another diagnosis. So we have to make sure that our diets, our minerals, our omega oils are all being supplemented. That's secondhand for you or for my son, but for many of our folks, listening, this is new, and it just makes sense. How would you feel if you ate your child's diet every day in, day out, week in, week out, and for the past 5 years? When I started, my son was only eating chocolate chip cookies, French fries, bacon, Fruit Loops, and a gallon of milk every day. Oh, and I gave him a Flintstones vitamin because I am a pediatrician. That's not going to support anything. That's terrible. So, all right, guys, first we start off with the diet and the gut. And we have to think about if your child hasn't been gluten-free, dairy-free, we have to be. And there's lots of resources to help you figure out what gluten is. My wife didn't know, okay? And so we took everything out of the house that was gluten-containing. But what if you've got a teenager, and I've had this, where it's like, man, you don't give me what I want to eat. It's clobbering time. Someone's going to pay dearly. Maybe we can't do that. And then you think, oh, I wish I did this when he was 3. It would have been so much easier. Yep. So I always also tell the families, let's focus on what we can do. If you've got a child who's not only just aggressive, but potentially very violent, and we're going to start tweaking their diet, and that may not be easy. So we'll have to go to the next step. How are the stools? I always say that if you're backed up within the stool department, I just saw a child today who, before they were seeing me, was stooling once a week. For some people, they think that's normal, because that's how dad does it, or mom does it, or the family does it. That's never normal. So we have to be moving our bowels twice a day. And that would go into a whole discussion about constipation and Dr. Jerry's approach, which might be different than another doctor's approach. But we have to make sure that we're emptying the trash can every day. I always say that whatever you do for a living, as autism and aggression is part of that, if your sewer system is full, it's going to be 10 times worse. For example, and I jokingly say this, that Miralax is my best seizure medicine. I'm joking, almost metaphorically. If I have a child who all of a sudden the parent's calling me up and saying, my kid's having more and more epileptic events, and I'll say, how's the pooping? I say, oh, I forgot. We haven't been watching that. I'll say, give the child some Miralax. Let's really clean out the sewer system. And then I'll hear back, oh yeah, the seizures are back down to where they normally are. Great, thank you so much. What did I do? I emptied out a site that was somehow contributing to lowering the seizure threshold, making them more apt to having seizures. Great, so we took care of that. What I'm saying is that if we're aggressive and we're constipated, we're really going to be aggressive, okay? If we're anxious and we're constipated, or obsessive compulsive and we're constipated, it's going to make each one of those things a whole lot worse. So let's make sure we clean out the bowels. If you don't know how to do that, we've got to find a doctor to help you pilot you through that to get that done. On the other hand, if we've got diarrhea, we've got to fix that too, okay? If there's something wrong with the bowels or inflamed or whatever, we've got to fix that. So another reason that kids can be aggressive besides the wrong diet, not having the appropriate nutrition or supplements to augment what they're not taking in, and the bowel issues, then the next thing we have to think about is communication. Many of these kids are just very frustrated and aggressive because they're not communicating. They have thoughts, they have ideas, they can't get them out. You're not quite understanding. And we see this between husbands and wives. There's nothing going on communication-wise, and I'm not understanding what you're telling me, and they get in fights. So communication is a real problem. Another thing that leads to aggression is anxiety, okay? If things aren't going the way that their mind perceives that they ought to go, and they're going to get aggressive. So anxiety is something yet we have to address. And we can talk, depending on how you want to go through today's conversation, through my approaches of this, okay? So the next thing is that I see a lot of kids in my families in my practices, they have too much adrenaline. Too much adrenaline. They have immature control of adrenaline. Adrenaline comes from the adrenal glands. I knew you guys knew that. And they sit on top of the kidneys. And the adrenals make a lot of hormones. And if you don't make enough cortisol, or if you make too much adrenaline or too much of both, you're going to have a problem. And we actually have two kinds of adrenaline: adrenaline of a rabbit and adrenaline of a lion. The adrenaline of the rabbit, that's going to make us hyperactive. They bite a lot, they pick a lot, they pick their skin, they chew on stuff, they're anxious, they're nervous Nellies, okay? That's the adrenaline of a rabbit. The lion, on the other hand, its adrenaline helps it when it's chasing after an antelope, focus and kill. Aggression, focus and kill. How that translates into my kids is these are my kids who will hit you, headbutt you, body slam you, property destruction. They'll break their iPads, they'll break the computers, they'll break stuff in the house, holes in the wall. That's noradrenaline, the adrenaline of a lion. The other one is the adrenaline of a rabbit. Now, I can block those two types of adrenaline, okay? And I can help them manage their cortisol, the other adrenal hormone. And then all of a sudden, aggression just drains, anxiety, gone. And it's like a switch, man. It's just like a switch.
Oh, that sounds good.
One of the nice things about adrenaline, though, that my parents can help me with is adrenaline always raises the heart rate. So you can either get a little pulse oximeter from Amazon.com for $13, and you can measure it that way, or you can take the pulse. But we can get a reading, and it's like, gosh, my kid just sitting there is 110, and it should be in the 70s. And when he's getting agitated but still cooperative, it's 120, 122. The other way is the Fitbit watches. You know, they give me a readout all day long, and I just got one today of a reading of a child, and nothing less than 100, nothing less than 100. So you can see when homework comes and they're getting agitated, speech therapist comes and they're becoming combative, I can watch what's happening. Well, that's adrenaline. Now I can watch that as I give them medications to lower the effects of adrenaline. I can watch those heart rates come down. So I like using those things for my aggressive kids. There are a few kids that I actually have to put on psych meds. I hate doing that. That's the last resort. You know, Abilify, Risperdal. I mean, I hate them. But sometimes I have to do that to keep them out of the psych ward because the parents have said I've had it, or the house dog got kicked really hard, or the sibling got kicked really hard, and they're contemplating putting him in residential care. And I've just started working with them. I said, give me some time. Let's put him on some Risperdal, get you out of the crisis situation. Okay. I promise we'll get him off in 3 months, but in that time, I have time to do my laboratory investigations. Mm-hmm. Another area of sources of aggression, just to kind of complete this. See, you thought it was just an easy question. Oh, how do you deal with aggression? Their brain can be on fire. Chronic inflammatory changes are occurred, or they have autoimmunity. Okay. This is all lab work that I can do. Obviously with the gut, and maybe they've been on a lot of antibiotics, they've got yeast, they've got bacteria. Whew. Is that enough?
Well, and my brain's like, woohoo, because I'm thinking there's answers and help to this, right? So like when you order lab work, might be a silly question, but is there lab work that can answer all those questions? Like you get like a one-stop kind of shop, like blood work, urine, stool, you know, and you can get all those answers to know, is it X, Y, and Z, you know, kind of thing.
I think the history, sitting down with the patient and finding out a little bit more can help me figure out where in the lab work I want to go. Because as you can tell, there's like a ton of tests I could be ordering. Mm-hmm. And the child only has so much blood that I can take at one time. But if I'm talking to the parents and they say, oh, my child has one bowel movement a week, I don't need any lab work yet. Okay, let's get the bowels cleared out. Let's do a bowel study, see what's growing in there. Because by the way, he's constipated and he's had a lot of ear infections and treated with a lot of antibiotics. In fact, he was just on an antibiotic 2 months ago for sinus infection. I don't think he's really recovered from that. He could have yeast in there, overgrowth of bacteria, this thing called SIBO, you know, small intestinal bacterial overgrowth. I always start with the gut first, okay, before I start looking at autoimmune, brain on fire, is this pandas, all these other words these families are going to be hearing about. Let's make sure the core is healthy, okay, because if your core is not healthy, no matter what I do, isn't going to be very effective.
And then when you're like, let's say you do a gut lab work, something to find out if it's, you know, the bacteria, the SIBO, the yeast, the whatever, right? How long does that take to get back? Because I know a parent's sitting there going, okay, he just described my child. So now if I want to do lab work, how long would it even take to get back? It's not an episode of ER. We know it's not done in an hour. I really wish it was. But, you know, is it 4 weeks? Is it 2 weeks? You know, how do we get these parents help?
Okay, so again, depending on where I'm at, like for example, if I'm trying to figure out, is this constipation causing a problem? I'll write a prescription to get an x-ray, they go get an x-ray, I'll have the answer the next day. Oh my gosh, she's FOS, full of stool, okay? What were you thinking? Full of stool, FOS, okay? And I can start right then, let's give him some, the kid's really particular, he doesn't like anything, does he like chocolate? Yeah, well, let's try some chocolatey flavored X-Lax, okay? We will figure out for that child what I can get into them because they can be very picky. And yeah, we can start right away getting things going. Blood work, depending on what I'm looking for, I can get just about anything back within 2 weeks. Even my esoteric autoimmune profiles and things, they can come back within 2 weeks. We can have it figured out as far as not every source of aggression, but between what I'm hearing the family telling me and what I see in the child, and you know, because we may find out this is, oh, his bowels are great, he's on the pristine diet, you've been with another doctor and all that's good. And I'm going, you know, this sounds like adrenaline and cortisol. Let's measure his cortisol level and let's start working on the adrenaline crisis that we're having here. Then we can start working today on that. So it depends on what stage of intervention my family has been involved with prior to seeing me, especially for our older kids, right?
Absolutely. And so that was aggression. Now let's talk about anxiety, because anxiety can feed into the aggression, right? So you talked about cortisol and all that. So let's talk about anxiety.
Okay, so I treat anxiety as a pain condition because anxiety hurts. And anxiety manifests itself in different ways in different people. Some people, when they're anxious, they feel pain in the core of their belly, like what we used to have before a test. Some people, I guess, maybe young women, for example, going to the ER with chest pain. It's almost never the heart, that's anxiety. So we can feel pain in our chest. Some people feel anxiety up in the neck. They feel like they can't breathe, okay? I mean, they just feel like their neck is closing in on itself and they can't breathe, and that's anxiety. And anxiety taken out a few extra steps actually becomes a panic attack, okay? So we have this anxiety. Now, where did the anxiety come from? Well, it can be by itself, I'm just an anxious guy, or it can be linked to an obsessive compulsive behavior that whatever we're obsessing about is not happening. I mean, in other words, we're not seeing it come the way we think it should come. Like the door, you left all the doors open. I want the doors closed. That's okay. Let's leave. We've got to go. And now the anxiety is swelling up. And the parents will say, I should have just gone in, closed all the doors. He'd have been fine and we could have gotten in the car. But no, I had to push it because the therapist said he has to get acclimated to not having things his way. Well, that's a response to a stimuli. The stimuli is the doors were open, they should have been closed. Okay, but it could be anything. So anxiety can be linked to an obsessive compulsive behavior that has to happen. That's why these kids can't be interrupted sometimes. And if you try to interrupt what they're doing, you can actually get clobbered because the anxiety builds like that, and you end up with that aggressive thing. So where does anxiety come from? It's a signal from the brain. It's an abnormal response to an everyday stimuli. That sounds like a lot, but that's kind of what all autism is, or abnormal responses to everyday stimuli. Usually it's over denial of something. We have to turn off of our iPad. I hate those things because it's like crack to our kids. Or we have to put on our shoes, or we have to wear clothes. Honey, you're 16 years old, you're a young lady, you can't walk around the house naked anymore. You make them wear clothes, and that's an anxiety thing because their access to being without clothes or without whatever it is creates anxiety. All right. So anxiety, again, is very often due to too much adrenaline. And I've got to fix the adrenaline issue, or not enough cortisol, or too much cortisol. I have to measure the cortisol levels. It's that darn adrenal gland, okay? But a lot of the kids get better when I put them on an antibiotic. What's that all about? Well, there's these words being, people will be seeing on the internet, these words called pandas, pediatric, here's the big A word, autoimmune, neuropsychiatric, that's the anxiety OCD disorder associated with strep. But it could be associated with a lot of other things. If it happens to be strep, then it fits in our cute acronym PANDAS, but it could be just PANS or whatever. But when I put them on an antibiotic, anxiety and OCDs go away. They get a whole lot better because I killed something that was creating some kind of autoimmune inflammatory nightmare in the brain, and they got better. Okay. So when I have other doctors try to put these kids on anxiety medications, I'm going, those don't treat constipation. Those don't treat bacteria. You wouldn't take Prozac for a urinary tract infection. Why are you putting them on Prozac for anxiety when you didn't even look to see if there was an obvious source to treat? So we have to treat them. Yeah. So anxiety is treatable. It's an end result to a stimuli that's not being managed appropriately. And we can't stop all of their triggers. I mean, that's kind of impossible. So it's like doors open, doors closed, lights on, lights off. I mean, it's endless with these kids.
Yeah.
Yeah.
Like I've noticed with my son, it's like you this goes away, but then that starts. That goes away, then it's like this kind of like, I think
we call that whack-a-mole.
Yes, it's a whack-a-mole. Yeah, it's like, I'm like, I get a lot of questions asked when going back a little bit back to aggression, and maybe it's a little bit on the anxiety as well. I get a lot of questions asked from families, their child's doing great, everything's fine. And when I say great in autism land, right? Where, there's not a lot of issues, they are progressing some, they're happy. And that's a lot of families are just happy that they're happy.
Quality of life, it's good.
Absolutely. But then puberty hits and it's as though they're happy and then no rhyme or reason, boom, aggression happens and they just kind of explode. And then it's interesting because you have aggression for some part of the time and all of a sudden they go back to being happy again. And I've heard it be explained like almost like Dr. Jekyll and Mr. Hyde, where they are almost like two different people and you don't know which one's going to come at you. And it seems to always happen around puberty. Do we have any rhyme or reason about this?
Well, let me think. Hormones. I think we're on the case of hormones here. So yes, we have, I find that our kids have a problem and it's neurological, controlling hormones, whether it be the thyroid hormone for some children or growth hormone for other children, or how much estrogen they make or progesterone they make. The feedback loops don't work. And you have to start looking at these kids. In fact, I think they start cycling before puberty is obvious. Okay, so you can start seeing puberty changes when 9 and 10-year-olds or 7 or 8-year-olds before they're showing outward characteristics of pubertal changes. The pubic hair, the breast buds getting bigger, the body odor, the acne, the mustache. Okay. So the puberty is really changing in our kids on the spectrum and kids in general. And our endocrinologists, the ones who specialize in hormones, are 100 years behind the times. I had one little girl who developed a full puberty, a whole pubic bush of hair, sent her to the endocrinologist, and he said, well, some 5-year-old girls just mature early. I'm going, what?
No
what?
way.
What?
Yeah.
Fourth graders starting their menstrual cycles is now considered normal, not precocious. Yeah. So we're changing our hormones. Now there's lots of concern whether this is xenobiotics, things that are coming to us in pesticides, herbicides, in our milk, whatever. That's not part of this discussion. The part is that both boys and girls who make too much testosterone are going to be aggressive and they're going to have changes. You're right. They're going to have
About
changes.
aggression for the families that are watching. When I'm talking about the aggression where, like, I've had emails from moms that are just scared. Their child was fine, and then their child wasn't, and the child's like the kind that's just hitting out of nowhere, punching walls. But then it's like this fine dance of, okay, but no, wait a second, they're okay now. And then wait a second, they're not okay now. And it seems to always happen when puberty hits. And I know there's lots of labs and everything else, but is hormones a key, player in this, do you believe?
Okay, so is it a key player? Yeah, it can be. It can be. You have to look at this as a multiple. You talk about autism, you talk about puberty, and you talk about them together. Each child is different. Each child for me is unique and exciting to figure out. In other words, let me put it to you this way. As a pediatrician, if I had 4 children in the waiting room and each one was coughing, you can diagnose cough. I can certainly diagnose cough. My wife can diagnose cough. But one's coughing because they got asthma. One's coughing because they have a cold. One's coughing because they got allergies. Another one's coughing because when they were playing with a toy in their mouth, it went down into the lungs. Okay. They're all coughing. I have to figure out the source of their coughing. I can't give each one an asthma inhaler. That won't work, but it will work great on the asthma guy. Mm-hmm. So when you talk about a prepubertal kid with aggression, that's their cough. I have to figure out where it's coming from. Is it from too much stool, the wrong food, too much sugar, too much food coloring, MSG, nitrates and nitrites? Or is there something wrong in the head? I better get an MRI and make sure that we don't have kind of brain swelling going on. Is this autoimmune? Is this hormones? Is this hormones? So when we talk about this, all I know is you come to me, I got a 12-year-old with aggressive behaviors, and it comes and goes. It could be inflammation. It could be allergy season. I see a lot of aggression. I put the kids on Singulair and Zyrtec, and oh my gosh, there's no more aggression. Well, obviously, then that wasn't hormones. Mm-hmm. So you have to be careful as a physician or as a parent who's going to Dr. Google trying to get it out. Oh, it must be. And the thing is, if I give a child, say you have a child who's got a cough, and I give your child the puffer, then you go on the internet and say, hey, if your child's got a cough, Dr. Jerry's puffer works on everyone. No, it only worked on your kid with asthma. It's not going to work. So if I found that your child had high testosterone levels and I lower your children's testosterone levels, you'll say, oh, if you've got a problem with aggression and it's puberty, it's testosterone. Mm-hmm. For your child, it was. And thank God we found something to help your child. But the next child say, I tried, it didn't work.
And I think that's the problem with the internet sometimes. And I'm definitely, guilty of this, probably like every parent watching. All of a sudden something's happening, and what do? You go to Google and you search symptoms, and then you search the word autism, and then you read this, and then you read that, and then all of a sudden, you're like, all right, my child, the way that they describe it is that he has 19 different things, and maybe he does, I don't know, but there's not one answer, and then you're just all mixed up. And what I've learned long ago is, yes, I do that, but I trust the doctors. I decided a long time ago, I am an MD, I'm mother determined, but I'm not a medical doctor. And so otherwise I'm just going to believe that, when I look at this Google MD thing, oh my gosh, it really, or WebMD or whatever it is, I can get so scared and then I can't sleep. And then I just decide I'm just going to leave it up to whom I'm paying to help me, and, who's helping me at that moment, because I can't figure it out. So guys, if you're watching this, I highly, highly, highly recommend work with a doctor like Dr. Jerry, who can understand all this, because guess what? We didn't go to school for this. In the what you're expecting books, none of it told us any of this stuff. It told us we're going to be moms and dads and playing, football and basketball. It never said autism. So this is definitely not our specialty. We know our kids, but we don't know our kids in and out in the way that Dr. Jerry does. Now let's talk about sleeping issues, because this is a big one for so many of our kiddos. Luckily I'm in the happy sleep zone right now with my son, but I've been in the not happy sleep zone, and it is just literally torturous. It really is. you never realize how much you appreciate sleep until you don't get it. And I also think it makes our kids wackadoo because they need sleep. So let's talk about puberty and sleep issues. And, what do we do with this?
Well, the good news is in puberty, usually sleep issues improve. That's when generally teenagers want more sleep. And in fact, you can't even get them out of bed. And I think that's always a crisis now, because at least where I'm at, they start school like at 7:45, 7:30. So if they get on the bus at 6, it's like nobody's ready for that. And even as parents aren't ready for that if we had a choice. So sleep issues tend to smooth. The good news is, for puberty, language tends to improve and sleep issues tend to improve, even if I don't do anything. But for our parents out there who has a child who's never slept, that's one thing. And they've never slept and they're 13 or 14 or 12. Then I've had parents who have been sleeping great, and now that hormones hit, puberty hits, their children aren't sleeping as well. They're staying up later. So I've had parents say, my child used to go to bed 7:30 or 8. Now that we're 12 or 13, they stay up till 10. Well, is that normal or abnormal? That's normal, actually. That's a normal thing. It may not be normal for the parents because they love their little pumpkins, but they love them more when they're asleep at 8 o'clock. Okay, so now they're up till 10. It's like, now what do I do with them until 10? And then we get into this true sleep problems. Well, number one sleep problem that I see is these electronic toys. They basically signal the brain not to make melatonin. And that's all these 2D screens, whether it's the iPad or the phone or the computer, the light that it emits basically tells the brain it's still daytime. Don't even think about making melatonin or preparing this brain for sleep. And what a lot of parents do, especially with special needs kids, is look, they love to play their crack iPad or whatever, and they're up, and then they wonder why they can't go to sleep. Mm-hmm. So we have to limit that. One of the best programs I've seen to help us control that is Disney Circle. Disney Circle has a program that will take control of all of your electronics, and if you program it to go off at 8 o'clock at night, it's off at 8 o'clock at night. So the parent is no longer the bad guy coming in to tell the kid, you have to get off, and risking bodily injury. So I like being able to take control of the electronic devices. That's number one. Number two, I love melatonin. Melatonin for many of the kids, not all, because there's nothing that works on all the kids. Melatonin for many of the kids, whether the pineal gland is making it up. Remember, we told you that these kids have a problem making hormones. Well, one of the hormones, melatonin, is made from a pineal gland, which is a small gland in the brain. And if it's not making enough melatonin, then these kids aren't going to go to sleep. When they actually were looking at children many, many years ago, I don't know why they don't anymore, they did a nice study showing that adults with autism and children with autism do not make enough melatonin. So if you don't make enough melatonin, it might be an idea to give your child melatonin. You do it for thyroid. If they're not making enough thyroid. I certainly have to do it with insulin for my son, who's an insulin-dependent diabetic. So if they're not making enough melatonin, you start out with melatonin and you give maybe 2 or 3 milligrams at say 8 o'clock with the goal of them being asleep by 9:30. But you have to pick the time you need them to be asleep by. So I like that. But there's a whole list of things that we can get into, whether it be GABA, vitamin D. And again, it comes down to nutrition. Also diet. The kid just drank, Mountain Dew and he won't go to sleep. Okay, well, good night. Of course not. Yeah. So we have to think again of what are we doing with the diet. Diets that have a lot of protein and some carbohydrates are going to be great. A lot of diets with sugar and food coloring are not going to be so great for getting a child to sleep. I suppose we also have to think, if all of a sudden we're not sleeping, do we have reflux? Did we develop something changed? Constipation, again, always wakes kids up in the middle of the night. So another pattern is, well, my kid goes to sleep great, but he's up at 2 in the morning. That could be because he's got some bowel pain and he's got some constipation going on. So we have to think about that as well. So it comes back to the core again, comes back to the diet again, comes back to the vitamins and minerals. Are we making enough stuff to help the child maintain sleep? There are a few kids where I actually put a red light in the room, 15-watt red light bulb for the kids who are waking up in the middle of the night. That's their night light, because of the fact that red light induces the brain to make more melatonin, blue light not. So I might do that. So again, you have to tell me, I have a child who doesn't go to sleep. I have a child who goes to sleep but doesn't stay asleep. I have a child who goes to sleep, stays asleep, gets up at 4 in the morning. You know, so obviously my approach is going to be different to each one of those kids.
Well, and I think that for families, it's like, I feel like you always have to be a detective, right? It's like, I feel like Sherlock Holmes sometimes, you know?
Well, that's the fun of my job. You know, when I was doing general peds, it was cough, cold, congestion, vomiting, diarrhea. You know, pick up a chart, 4-year-old with cough and has ear pain. It's like, you already told me what I need to know. With these kids, you have to figure it out. You're right.
Yeah, definitely. Now, I want to talk a little bit about puberty and seizures. I know you touched on it a little bit, but I just,
Yeah.
you know, when you hear the studies or you hear the, whatever we call it, I don't know, you see the things online that says almost 40% I've read that hit puberty could potentially have seizures, especially the boys. There has to be a reason for this. I imagine there must be a medical reason. My son was one of the lucky ones that got that membership card. I always joke, I don't need any more membership cards unless it's to Club Med. I really didn't ask for this membership card. I was perfectly fine just in the autism world. I didn't need to be in the epilepsy world. Last September, we had our first one. And then the doctor said, but don't worry, Kristen, you have to have 2 to be part of that club. Well, then the 2 came, the 3 came, the 4 came, and we've got, knock on wood, we've got them under control, we hope. However, this is not happening just to me. This is happening to thousands of families across the world. How, first of all, why? And then how do we, you know, is there a way to prevent it? You know?
Okay. So it's very difficult, the why. I have 2 offices, one here in Orlando, Florida, one in Irvine, California. My office in Irvine, California is a stone's throw away from UCLA, USC, Loma Linda, UC Irvine. Down south is UC San Diego. Up north is the Mind Institute at UC Davis, UC San Francisco. What work are they doing on our kids?
Not enough.
Nothing.
Yeah.
So when you said why, what have the medical schools, the universities done to help us figure out not only why do they have seizures, what's going on in the brain, and how can we change it? Because a lot of families out there are probably nodding right now when I say the seizure meds don't work. They put them on this medication, take it up, it doesn't work, changes their personality, they get irritable, and they say, oh, okay, so let's take you off of seizure medication 1 and put you on seizure medication B. 2. We put them on seizure medication number 2, nothing happens. Then we say, well, let's put you on 2 and 3 because maybe together they'll work, or 2, 3, and 4, maybe they'll work. And it's not working. 30% of my practice has epilepsy. And I agree with you, that's a tough one to have. At least with my son's diabetes, I can control that blood sugar and I can control his insulin, and I got it. Epilepsy, I'd be like you, it's like, where did this come from? We haven't changed a thing. Why today? I think it's due to a lot of inflammation. And the signals in the brain are inflammatory, and that's why the seizure medications don't work, because they treat something different. If you would, a different type of epilepsy. This epilepsy that seems to be associated with autism, very difficult. And I know more than one neurologist who just doesn't want to treat these kids because they're frustrated like you and I as parents are. They don't get better, no matter what I do for them. The first thing I hope for is nothing bad happens, like they get the life-threatening rash with some of these stuff, but nothing good happens. And all of a sudden I'm getting called to the ER again to see my patient who's seizing because the Depakote didn't work, or the Lamictal, or the Vimpat, or the Omfi, and on it goes. So I think there's an inflammatory response.
And there's side effects to the medications as well. So it's like you don't want seizures, but then you have to deal with some other stuff, you know, and maybe this is causing this and that. It's like your brain just goes whoosh, you know, after a while.
So there seems to be, I mean, in the course of autism, you can have an epileptic event pretty much any time. But you're right, the clusters seem to be around 7, 8, 9. and then another run around 13, 14, 15. Those seem to be, if you had to graph them out, that's kind of what you're seeing, okay? And these aren't the seizures that are associated like with a high fever from a cold or something. These are just like out of nowhere. Another seizure, obviously, is the staring spell seizures. We used to call those petit mals. They're absence seizures now. And that's another seizure that you can have. And that's where the kid just all of a sudden seems to be checked out for a moment and then comes back to us. They don't fall, they don't vomit, they don't do anything. So I guess our approach to epilepsy is still, again, trying to understand what the underlying mechanisms that brought their brain to a point where it seized, and constipation, the right minerals, the right vitamins, not eating foods that are provoking autoimmune disease. And I think when we have a child, especially on the autism spectrum, who presents with a new onset seizure, you have to roll out the red carpet and really look for an underlying cause and not just say, oh, some kids just get epilepsy. That might be true for some kids, not my kid. Let's figure out the source. Is this an autoimmune process? Let's do all the autoimmune markers. Okay, let's get the rheumatologist involved. Why so? Because a lot of epilepsy that I see is treated rheumatologically with IVIG. It's an immune system issue, anti-inflammatories, keeping the bacteria in the bowels down because we don't want inflammation anywhere in the body, and they can be more successfully treated than the child who's just put on a seizure medicine like Lamictal. Okay, so I agree with you. It's tough. Are there supplements to help with this? There are, but I haven't found that they have enough horsepower, if you will, to get the job done to keep the child seizure free. Next thing you need to look at too is what's going on with the EEG. Okay, they need an EEG that's at least 24 hours, preferably 72, but insurance will only pay for 24. That's fine. Is it abnormal or normal? That's what I need. Do I have a kid with epileptic events with a normal EEG? Is going to be different than a child with epileptic events with an abnormal EEG. And I have to look at that. When we put a child on a seizure medicine, this is what neurologists don't do unless I twist their arm. Well, I want an EEG after you have the child on the seizure medicine because you're saying, oh, it's working. Well, maybe it is, but maybe it's just not a good day to have a seizure for the past 3 months. He just wasn't going to have it whether he was on Lamictal or not. So you want to see, is this really changing the EEG pattern or not? So especially with that. I had one little girl, she probably had about 1,000 epileptic events per night during sleep.
Wow.
Okay, so therefore she wasn't having the normal sleep. She wasn't able to file her memories away because that's what we do during sleep and clean the brain. And she wasn't the most pleasant child during the daytime. Okay, so we had to figure out a way to get her epileptic events under control, and it was with IVIG. UCLA gave up on her. They said, we have nothing to offer her. The neurologist says, well, I don't have anything to offer her. And at least they're being honest. But most of these doctors, if you don't fit their wheelhouse, they let you go. And it's like, well, I wish I could do that, but I can't let you go. You're stuck with me. So we're going to figure this out.
Absolutely. Now, last topic, just quickly, because I could listen to you forever. You're so fascinating. I'm learning, and I've been a veteran, what we call in the autism world, for 14.
I'm still learning. Every day I'm learning.
I feel like if we don't learn, how are we ever going to help our kiddos, you know? And it's like,
well, they keep us humble because, you know, as soon as I think I know what I'm doing, I'm pretty sharp at this. The next kid's going to slap me down, going to give me this finger. You don't know me. You think you can treat me with this stuff? I'm going to, and they'll blow up. You know, I've had kids, again, remember when you're working with kids, they can blow up with the wrong probiotic. Who blows up with probiotics? Cod liver oil, vitamin C. They become hyper irritable with B12. But I heard that B12, I've had kids develop fevers with ibuprofen, like Motrin. I've had kids break out in hives with Benadryl. I mean, that's what you use to treat hives.
yeah.
These kids keep you very humble, and you say, let's start slow and work our way up and see how we do.
Yeah, they definitely don't fit any box. They're not even a square peg in a round hole. They're like a whole other shape. Now,
Exactly.
when we're talking about, I just briefly want to talk a little bit about, suddenly kids need to shave, their hair is growing. Do we have any tips on this? And I may be asking for me particularly.
Well, you look great. I don't see any hair. You're
My
doing
fifth grade mustache went away, but so my son, and here's the thing, when do we know when to even start this? And this is I'm sure I can't be the only one out there that has this question. My son went from the little kind of shadowy thing, and it's still a shadow. I'm really in denial. I think I am in denial. It's a little bit more than a shadow now. And I'm not sure where we begin with that. I don't know if it's because I'm a mom, and I'm sure other moms watching probably feel the same way. I'm sure your wife felt the same way. The minute you have to do the shaving thing, it was already hard enough with the deodorant thing, right? That was like a really big eye-opening moment of, what do you mean he's stinky and I need to get deodorant? Now, this whole mustachey thing, how do you know when to start? Is there tips on this? This is a whole new world for me. So,
okay. So it's very dependent on how sensitive the kids are, obviously. I think the shaving thing, the longer you can put it off with the young ladies and the hair on their legs, again, everyone's different. Some young ladies are high functioning and they want their legs to be silky smooth. They don't like the feel of hair on their legs and they want it off. And that's a good sign that we can start, shaving the legs, and they will need help with that. With the boys, if they have just a shadow, I let it go, because as soon as you start shaving them, that somehow stimulates more hair growth. It doesn't work for me anymore. I'm trying to stimulate my hair growth, but it's not happening. So, but on the face, we can actually stimulate the hair growth. And so once you start shaving, you're in for it. I like getting them used to either, if dads are doing it, they like to use the razor, the Gillette 5-head thing. But what's really good also is the electric shaver. And I knew you were going to ask that, so I brought one for you. The one that works great for kids. Let me pull it out. There it is, my prop. This is a type of shaver that works great for the kids because it's quiet.
What is that one called?
This one is the Philco Norelco Series 7000, okay? But it's quiet because the kids have a problem with noise. And it's not one of these loud buzzing things, and it recharges. It's easy to clean. And the idea is that they can't cut themselves with it, okay? And even if they're just kind of going through the motions, eventually they'll get used to it. And I think that's really good. It doesn't, when they're doing it, may not do as good a job as you would do, but it's getting them used to their own self-care, just like brushing teeth and stuff like that. When they brush their teeth, as you know, it's not a great job. You go in there and you buff it up, but at least they're going through the motions. And over time, because these kids are lifelong learners, they will master the shaving. Some of the kids get very thick, coarse hair, and this may not work, and you actually have to go in there with a shaver to shave them. So when to start? I like to wait. But a lot of the kids, they decide when they want. They don't want that anymore. You have to supervise it, especially if you're using a razor. And usually the dads can do it. The higher functioning kids can take over doing it, but they need to see it modeled, just like dads with neurotypical. So when we try and work with these children, we have to see just how sensory they are. Are they going to tolerate shaving cream? If they're not going to tolerate shaving cream, and they're certainly not going to let you doing that, that's what's so nice about this. This can just buzz really quickly and you're done. And as they get used to that, they can actually take this and take over this, and they can't hurt themselves. Even if they do their hair, it's not going to hurt themselves. If they have a thick beard, like dad, just really masculine, then you may actually need to use a shaver that's got the blades in it. That has to be started with dad and let them work with it too. Some kids need to be shaved and they just can't. With showering, some kids just miss the top of their hair. They just can't wash the top. They can soap all their parts up and everything, but they can't shampoo their hair. It's just that part is not filled into their brain, and they just don't know it's there. Same thing with that. So bottom line is, wait till they actually really need to shave. The longer you wait, the better. Select the device that you tend to use that would fit their sensory issues. No cream, no water, quiet. This is the way to go. They don't mind cream, they don't mind water, and they got that thicker beard that needs it, fine. It's like, for example, my boys who are blonde, beautiful blonde hair, blue-eyed guys, they don't need to shave till they're 19, okay? And because what they're growing is so fine and so white, you're never going to see it. But then I've got my families that are darker pigmented, and they're going to have a lot of hair. We'll start early.
Well, I think that you've given so much great advice, and I feel like this is just such a topic that I think is really overlooked. You know, it's great when your child's 2 or 3 and you're learning, and they are cute and you can hold them on your hip still. But at 16, 20, 25, they can hold
You're not
us.
holding them on the hip. Yeah.
For those of you guys that are watching, you know, this is something that you guys can go to autismhopesummit.com and you guys can buy the whole entire package with over 25 of amazing experts like Dr. Jerry. So that way, not only you can watch it, your significant other can watch it, maybe your parents can help watch it. I always think the more people that we can educate in our family, with our friends in our village, I feel like it's just such a better resource for our families overall. The other thing is, every time you guys buy the package from the Autism Hope Summit, those dollars are raised so that the Autism Hope Alliance can give more nutritional supplement scholarships to more families across the country. So to me, it's a win-win. So again, go to autismhopesummit.com, be able to keep Jerry forever in your archives, which would be awesome. And then I want to talk about, you are giving a free gift, and I want you guys all to know about it. It's part 1 of a bonus talk from Dr. Jerry. It's Autism, Special Needs, and ADD, an Integrative Approach. So thank you so much for giving that to all the families today.
You're very welcome. Our pleasure.
Well, and I have so enjoyed talking with you. I've enjoyed knowing you throughout the years. You are just definitely one of our big warrior doctors out there, not giving up on us. So from the bottom of my heart, I know you're super busy. You're all over the world. And thank you for taking this time. Is there one message you want to leave with families? You know, because I know there's brand new families. And then obviously I know there's families that have been doing this a while. Is there a message that you want to leave for them?
Well, I always try to encourage our families to do the most for their kids and improve their child's quality of life. We do that, then of course, selfishly, our quality of life improves too. You know, I always joke that it seems that my wife and my boy are still connected by the umbilical cord. When he has a good day, she has a good day. When he has a bad day, she has a bad day. So for us guys, selfishly, if we want our wives to be happy or we make our kids better, it works for us. Hey, these kids have a lifelong learning skill set, okay? They may not grab everything they need to by the time they're 14 or 15, but as they get older, they get sharper, they get to be a lot more fun. If we can get rid of these, how should I put it, very annoying behaviors of aggression, anxiety, obsessive compulsive behaviors, the rituals, the pacing, if we can improve that, our kids are improved and we just can really enjoy them. Make sure that you're doing everything you can for the kids that's possible. And I think it'll just make everybody's life a whole lot more enriched.
Absolutely. And guys, don't forget, we're not going to give up on you. We're not giving up on our own kids. You know, we're in it for the long haul. And I just do really believe that children are capable of limitless growth at any age. So whether they're bigger kids and bigger problems, we're going to find doctors like Dr. Jerry that are going to figure out ways and not giving up, because, you know, but it's hope with a plan, and that's what this whole series is about. So until next time, bye guys.